And it's great to be here with all of you. Good morning, everyone. I want to thank our... It says on. Did I do that wrong?
No, you did it perfectly.
All right. It is on. There we go. Okay. So I want to thank Deputy Health Commissioner Heather Aaron, Mayor Champagne, and the town of Vernon for hosting us today. We really appreciate their great work, and I want to give a huge shout out to the National Guard and Sergeant Gray. Where'd you go? Thank you so much for all that you're doing with logistics to help us roll out our statewide testing and vaccination effort. So this is a critical time with the rise of the Omicron variant of COVID-19. We need to stay vigilant. As of Friday, the 14th, Connecticut's positivity had gone down a little bit. It was 19.35%, which means that 19.35% of our friends, families, family members, co-workers have been directly affected by this virus. We have now 1,895 patients in the hospital. 66.2% are not fully vaccinated. So the need to keep ourselves and our communities safe is really important. We can do that by getting tested. And the town of Vernon and the state of Connecticut have made it easy for people in this area to just come on in. They prefer if you let them know you're coming, or you can feel free just to walk in. They're accepting walk-ins as well. We want to get the message out that it's important to get boosted or vaccinated if you haven't received a vaccination. We know that there are more people in the hospital with COVID-19 who are not vaccinated. So that is a really important message, and we appreciate our media partners coming today to help us get that message out. We want to continue our record here in Connecticut of being the top tested state. As of the end of the weekend, 3.1 million testing kits have been distributed for this wave here in Connecticut. The home tests kits aren't always accurate, so that's why if you feel any symptoms, if you're not well, if you have been around somebody who has had COVID, please come out and get tested. And we really appreciate what the town of Vernon is doing to make this testing easy and accessible for everyone in this area. And it is now my pleasure to introduce the Deputy Health Commissioner, Heather Aaron, for a few words.
Good morning, everyone. Thank you, Lieutenant Governor. Thank you to the mayor and our service folks, and to our town administrator, and to Jackson's Lab, and everyone here, and all the staff that have been working. This is not the first go around. Everyone has been working for a very long time on all these processes. We are very happy that Vernon has allowed us to come into town and to add this testing site. This is the 26th state testing site that we have started. All of the sites are very active, and we're very pleased that everyone is coming out to get tested. The goal here, again, is to continue with the three-pronged approach: testing, masking, vaccination. Most important one is vaccination. And just some late-breaking news that I just got some updated numbers, Lieutenant Governor, on our positivity rate is down a bit to 17.09%. So we're going in the right direction, and we're hoping very soon that the trajectory of this Omicron variant starts to tip down a little bit, and as that number goes down, then we'll see the curve turning down. However, we do have 1,857 admissions that are in the hospital that are because of the Omicron variant. 67, nearly 67.5, nearly 68% are unvaccinated. So again, the message is going to continue to be that we need to get vaccinated. We are hoping that this will be the end of things, but realistically, if we don't get to a high degree of vaccination, we may continue to see different outbreaks. So we appeal to you from the Department of Public Health to talk to your colleagues, talk to your neighbors. Please let everyone get vaccinated. While you're unvaccinated, or even when you're vaccinated, continue to get tested. Because we do know that there have been breakthroughs, but the breakthroughs with Omicron has been very mild for those who have been vaccinated. So again, thank you so very much for allowing us to come out here and do this work. I want to thank Jackson Labs and Griffin Hospital for their team. They have been working tirelessly from the beginning. Jackson Labs was one of our first labs to participate with us in the beginning in 2020 in March, and they have continued. Griffin has also continued and stayed the course with us. So we're glad for all our partners, and we're very grateful. So thank you so very much. Thank you.
Thank you, Madam Deputy. I'd now like to introduce the mayor and also state senator for this area, Dan Champagne.
Thank you so much. You know, Vernon's been one of the leaders as we came out in the beginning and we started our vaccination clinics. We were handing out food. We were finding every way we could to handle this crisis. And, you know, this is a continuation of the testing that we've had going. And we've had a great team working here in Vernon for the testing. So to partner with Griffin Hospital and Jackson Labs to continue this testing site here is very important to us. We have hundreds of people come through every week, and we're hoping that the whole region will make out better with a regional test site that you can just drive up if you need it. The Omicron version, thankfully, it's very catchable, but it appears that the symptoms are a lot less worse. So we're hoping we get through this and the numbers start coming down within the next month or two. And in the meantime, we're going to continue our testing. We're going to continue to do everything we can here in the town of Vernon, for the region, for the town of Vernon, just to keep everybody safe. Thank you so much.
Mayor, thank you so much. It's my pleasure to introduce the Vernon Town Administrator and Emergency Management Director, Mike Porcaro.
Thank you, Governor. And thank you, Mayor. You know, we're very excited today to announce the opening of this state-sponsored regional COVID PCR testing site here in the town of Vernon, Connecticut. Through an innovative and creative public-private partnership sponsored by the state of Connecticut between the Department of Public Health, Griffin Hospital, Jackson Laboratory, the North Central District Health Department, the Connecticut National Guard, and the town of Vernon, we are pleased to be offering no out-of-pocket cost COVID PCR testing for any resident in Vernon, for our neighboring communities, for the eastern part of our state and beyond. All are welcome. And because of the amazing teamwork that you heard the mayor, the governor, and the commissioner talk about between Griffin Hospital and Jackson Laboratory, people can expect their results within 48 hours of testing or sooner. And from what I'm hearing, they're actually getting the results sooner than that. When you talk about public-private partnerships, most people usually think about contracts, negotiations, and purchase orders. These things are very important. However, more importantly, in order for a public-private partnership of this magnitude to work, it's really about the people on the team, the boots on the ground, as the National Guard refers to it. Building relationships and working together efficiently, effectively, and with a unity of purpose among local, state, and federal government and across various departments and organizations. And that's what we built here today. Regardless of our different personal, professional, or even political backgrounds, today we stand here united by a shared belief at the core of public service, helping people. And that's what this is about, helping people. Through this public-private partnership, the town of Vernon is proud to be serving and helping the residents of our state alongside the high-performance teams at Griffin Hospital and Jackson Laboratory. To our new friends and teammates at Griffin Hospital and Jackson Laboratory, or JAX as they like to call themselves, we are grateful for your partnership and for your shared commitment to serving others. Of course, none of this would be possible without the leadership and support from the state of Connecticut and the partnering agencies and staff at the Department of Public Health and the Connecticut National Guard. So thank you, Lieutenant Governor Bysewicz and Deputy Commissioner Aaron, for your support. We appreciate it very much. Thank you.
Mike, thank you so much. It's my pleasure to introduce the Vernon Director of Health, Patrice Zulik.
Thank you very much. Good morning, everyone. I just want to echo all of the comments you've heard. This wouldn't have happened, getting the testing site expanded and continued. And I do want to point out, continuing to operate, even though so many of the testing sites have been impacted by weather, the town of Vernon keeps trying to find a way to keep those testing sites going. We have the public's attention. People want to be tested, and then we found we didn't have enough testing resources. And so again, just to echo, the partnership of everyone working together is what created what you see here today. And as the Public Health Director, North Central District Health Department, I just want to say we've got work to do. Please, people, consider getting vaccinated if you haven't been vaccinated. Consider getting boosted. Wear your mask when you're indoors and in proximity to others. You may protect yourself. You may be protecting a fragile member of your family or a fragile member of the community. So again, thank you so much for putting all the attention on these important testing sites that everyone's working on to get up and running. Thank you.
Thank you, Patrice. Griffin Hospital has been a huge contributor to the infrastructure of testing, which makes our state one of the top tested states in the country and one of the top vaccinated states in the country. And it's my pleasure to introduce Todd Liu, Vice President at Griffin Hospital.
Thank you, Lieutenant Governor, and thank you for the invitation to join this morning's press conference and just talk for a few minutes about the importance of being tested. Before I do that, I do want to just acknowledge some of the thanks that have been expressed by others before me. This truly is a partnership, and it truly takes a village to be able to stand up something like this. And we could not do that unless we had the support, first and foremost, of the state of Connecticut through the Lieutenant Governor's office, and then also through the Department of Public Health. They have been tremendous leaders throughout this pandemic in all aspects of making sure that we are kept as safe as possible. And as Deputy Commissioner Aaron so appropriately said, that includes masking, that includes vaccination, and it includes testing. And testing is what we are here today to talk about. The Lieutenant Governor also alluded to the fact that there is a difference between home testing and between in-lab testing, which we refer to as PCR testing. And not all COVID tests are not created equally. So let me just talk very briefly about that. And Dr. Lee, when he gives comments, may also want to talk a little bit about the difference between the sensitivity and also the accuracy of those two different tests that people can get. At-home tests are good, but they're not as accurate. They're not as efficient, and you're not going to detect COVID as early as you will if you have an in-lab test. We are doing PCR testing at this testing location, as well as the other locations that are being stood up across the state. So that really is the gold standard for testing. We have a rapid, high-throughput testing model here in Vernon that we've been able to stand up with the help of our partners, both at the city and also through Jackson Labs. So we implore you that if you have any symptoms or if you feel you need to get tested, please stop by. We'll get you in and out very quickly. As folks before me stated, there is no out-of-pocket cost to get tested. Right? So it doesn't cost you anything to get that peace of mind and make sure that you are keeping yourself, your friends, and your family safe. Thank you very much. Again, we appreciate the partnership with the state, with the town, and also with our partners at Jackson Labs.
Thank you. All right, thank you so much, Todd. And now it's my pleasure to introduce Charles Lee of Jackson Labs. Thank you so much for all your help.
Thank you, Lieutenant Governor. Since the beginning of the pandemic, the Jackson Laboratory has been committed to assisting our communities in responding to the pandemic. And we've leveraged the JAX expertise and infrastructure to provide COVID testing to first responders, nursing homes, and schools. And we continue to sequence positive COVID specimens to identify new variants and prioritize the breeding and distribution of unique mouse models by our colleagues in Bar Harbor for worldwide coronavirus research. When the pandemic hit, our nonprofit adapted quickly to provide fast and accurate testing for members of our medical community who are working on the front line of the pandemic. And this effort, which began as an initial partnership with the Connecticut Department of Public Health, Yukon Health, Hartford Healthcare, Griffin Hospital, and others, grew over time to include now more than 60 partners, and to date we've done approximately more than 200 million patient sample tests for our healthcare and community partners. At this time, we're very proud to answer the call again and to help provide expanded and regional COVID-19 testing for area residents in the northeast portion of our state. On behalf of the Jackson Laboratory, I'd like to thank the state for its continued efforts to be responsive to the testing needs of Connecticut and that of the town of Vernon, and Griffin Hospital for your great support, coordination, and collaboration at this site. Thank you very much.
Thank you, Charles, and we really appreciate our media partners coming to help us get this critical message out, and we will open it up for questions. We have all of these incredible experts here to answer most anything you can come up with.
Lieutenant Governor, I'm not sure this could be a better question, I'm not sure which, but I know part of the excitement today, there's a Vernon testing site, but also there are plans to ramp up testing and add more testing sites throughout Connecticut. Could you touch on a little bit about some of those upcoming plans?
Yes, absolutely. It's important that testing sites like this be available all over the state, and I'm going to bring up our Deputy Commissioner to talk about how we are standing that up. Deputy Commissioner.
Okay, thank you very much. So at this point, we expect to bring on an additional 6 sites over the next week and a half or so. It takes us about 7 to 8 days with working with the different sites to get everything set up. So the plan is to continue to expand and to hold. If things start going down, we'll slow it down a bit, cut down hours if necessary, but we will continue to build these sites as much as possible wherever it is needed.
Mike, can you tell us in terms of volume just what this site does for the region to increase testing opportunities?
As far as I can talk in general about all the sites,
I'm sorry.
He wants should be.
Thank you, Commissioner. Over the past several weeks, we've seen a huge increase, huge demand. As you recall, starting a few weeks ago, there were lines backed up in test sites across the state. And, we came up with some innovative solutions here. We started doing a ticketing system, and then we said that's not enough. And at the mayor's direction, we wanted to offer more, and that's when we reached out to the State Health Department to make Vernon a regional testing site. So the numbers we've seen prior to the past few weeks, we were doing testing twice a week with our former partner who was very, very good to work with at Semaphore Labs. And we had two test sites going, one here indoors, one outdoor at Rockville High School, drive-through format. On an average, we saw about 100, 150 cars coming through at each site, or 100, 150 people walking through here. But then over the past several weeks, those numbers have gone off the charts. 200, 300 plus, and we've had to turn people away. And we don't want to do that. We don't want to turn people away. As you've heard from the experts behind me, testing is a critical component, a critical layer in this fight against this disease. So we want to offer more, and that's what we're doing here today in partnership with the state.
Just to follow up on Roger's question with the Deputy Commissioner, keeping over from Box 61, I know you spoke to hopes for an additional 6 sites For folks watching at home, geographically, do we know where those sites are, or is that still to be determined?
I can tell you that we expect to put a site up in Putnam and to focus some new sites in the New Haven area and also in the eastern part of the state. But the Putnam site is coming up.
This also might be for the Deputy Commissioner of the District of Jackson Lab, but is Griffin and Jackson Lab taking over all of the semaphore sites that the state can run? I know semaphore is doing this.
Sure, certainly. At this time, the statement we like to make is that anything that Semaphore was doing, we are working on coverage. We do not expect to have any gaps. Griffin and Jackson's Labs have stepped up, and we are also looking at other contractors who are on our state contracting contract to work with them to open up sites.
And a question for Mike. You started this a couple of months ago, right? On your own, couple days a week. What made you back then decide to start up your own testing?
Great question, Dave. So we want to do more for our residents. The demand is there. We felt that there's a need for local government in partnership with state government to fill that need. You know, we don't want to be in the vaccination business or the testing business forever, but if the public we serve has a need for it, well, we're going to step up. And that, as the mayor had said, has been our standard operating procedure throughout this crisis. We've taken a leadership role with vaccination, so it was a natural progression for us to take a leadership role with testing while the public needs it.
Is this going to be a 40-hour site? Are all these going to be 40-hour sites that you're standing up now?
Why don't you do that?
Dave, I can speak to this site. This site has up to 40 hours, and I can tell you when I say high-performance teams at Griffin and Jackson Labs, you know, they're very flexible, very easy to work with, and it's based on public demand. If the demand is there, we'll be here 40 hours a week, maybe more if needed. If the demand is not there, well, then we could adjust on the fly. Literally, we're in communication with Jackson Labs and Griffin Hospital on a daily basis, making those decisions and adjusting based on the public's need.
Anybody else? Going once?
So how do people sign up here? Is it online or?
People can sign up by going to the Town of Vernon website. There's an online registration system that's interoperable with Griffin Hospital and Jackson Laboratories registration, so it's very easy. And if you register in advance, it's easy in, easy out. Very quick, everything's pre-printed, there's a whole system and process put in place, but walk-ins are welcome.
Anybody else?
Just so we're clear, this is not a new site, just a new partnership, expanded, continue. I just wanted to, if someone could just sort of just clarify all of that for me so that we don't.
Sure. So this is a new partnership with expanded testing capabilities with Griffin Hospital and Jackson Laboratories. We were operating this site 1 day a week previously with Semaphore Labs, who was a great partner, and now we're transitioning to this new team and allowing more testing and expanded hours.
And Lieutenant Governor, can you just talk about the positivity rate in a nutshell, how, you know, we were hovering above 20% for a while and now we're kind of hovering underneath it?
That's right. So we were bumping up on 24, 25% positivity. It is fortunate that now we're in the 17% vicinity. It's still very, very high. The good news is if we look at the UK, if we look at some of the other high positivity states like New York, we're starting to see a plateau like we see in these other areas already. So that's good news. Unfortunately, we are not out of the woods yet, so please continue to get tested if you feel sick. Please get vaccinated or boosted if you haven't been. And I think the Deputy Commissioner had something that she wanted to add.
Hi. I just wanted to clarify, because I know there's questions, and the gentleman over there asked whether or not Griffin is taking over all of the sites. I want to be clear that Jackson Labs has a contract with the state of Connecticut regarding this testing. Griffin is partnering with Jackson, not necessarily partnering in contract with the state of Connecticut. So just to be clear, that it's a Jax contract, and Jax is working with Griffin. Thank you.
Okay, any other questions? All right, thanks everybody so much for coming out. We really appreciate it, and we're going to let the people in to get tested.